Hi, welcome back to my channel. In this video, I will be revising all the foramens of the skull and the structures that pass through it. So I have a list of them and I'll just be writing the components and will also help you to remember them as well. So first of all, we have supraorbital foramen. So it transmits supraorbital nerves and vessels. Infraorbital, similar infraorbital nerves and vessels. Now, mental foramen is important. It is located between both the premolars. Now, mastoid foramen, it has a mystery vein connecting sigmoid sinus with posterior auricular vein and meningeal branch of occipital artery. Then incisive foramen, very important to note that it is also called as foramen of Sarka. So it has basically the greater palatine vessels and nasopalatine nerve. Then greater palatine, obviously greater palatine vessel and anterior palatine nerve, which is also called as greater palatine nerve. Lesser, we will say it has middle and posterior palatine nerve. Then coming on to palatovaginal, important. In this, you have to just remember that we have P for palato and we have pharyngeal branches of pterygopalatine ganglion and pharyngeal branch of maxillary artery. Vomerovaginal is pharyngeal nerves and vessels. Now we all know foramen of a whale and the way to remember it. So MALE. So we have middle meningeal artery, accessory meningeal artery, lesser petrosal nerve, and by E we have a mystery vein connecting cavernous sinus with pterygoid plexus of veins. From foramen rotundum, you have to remember M. So this we all know, maxillary nerve, optic canal, optic nerve, and ophthalmic artery. For spinosum, remember ending with M, middle meningeal artery, middle meningeal vein, posterior trunk, and meningeal branch of mandibular nerve, which is also called as nervus spinosus. Then foramen of magnum, it has three parts. The first one being anterior, then through subarachnoid space, and then we have posterior. Now you need to know it very well. So anterior has apical ligament of dens and membrana pectoria. Through subarachnoid we have spinal accessory nerve. Then we have spinal accessory nerve, vertebral artery, anterior and posterior spinal artery. Then through the posterior we have lower part of medulla and meninges and tonsils of cerebellum. Now important thing to note here is that these the ones that I'm marking, they are descending structures, okay, and these are ascending structures. Okay, then we have foramen lacerum again, and so just remember meningeal branch of pharyngeal artery. In carotid canal, we have internal carotid plus the venous or sympathetic plexus around it. Then hypoglossal, something that you should know. First though is our 12th nerve itself. Then we have the meningeal branch of hypoglossal nerve. Then meningeal branch of ascending pharyngeal artery. Then emissary vein connecting sigmoid sinus to jugular canal. In posterior condylar, we have the sigmoid sinus and suboccipital venous plexus की emissary vein. Alright. Now foramen transverse area. Now you should know that it lies in the vertebra, right, cervical, and on the transverse process, as the name is telling you. Alright, so foramen transverse area, obviously it is going to have our vertebral artery and vein, and most important, it has inferior cervical ganglion. Now here something you should notice that foramen of cecum is present in two bones, ethmoid as well as tongue. How what is foramen of Monro? It is basically the interventricular foramen. Lateral ventricle opens into third ventricle. Alright. Then the foramen of Magendie. This is basically a medial opening in roof of fourth ventricle. Foramen of Leschka is lateral recess of fourth ventricle. Now I already have made a video on superior orbital fissure, so I'll just enumerate once again. So first of all, you should know that there are three parts: lateral, middle, and medial. Then I told you to remember LFT, like lacrimal frontal trochlear nerve. Then I told you to remember the middle meningeal artery. Okay, lacrimal part. Then in middle, I told you to remember ONA or NOA. So oculomotor nerve, nasociliary nerve, abducent nerve. Here I told you to remember inferior ophthalmic vein and sympathetic plexus around ICA. This is most commonly asked question these days. Structures passing through inferior orbital fissure. So you should everybody remember superior, but you should also remember the inferior orbital fissure. In this, first of all, the foremost you should know is zygomatic nerve. Then we have maxillary nerve. Then we have orbital branches of pterygopalatine ganglion. Inferior ophthalmic vein. Alright. Then internal acoustic matters, it basically transmits the 7th and 8th nerve plus labyrinthine vessels. Now jugular foramen is like the most important. You need to know what passes through jugular foramen. You can't skip this. So this also I will tell you. Basically it has three parts: jugular foramen, anterior, middle, and posterior. First you can remember it as SIM. Alright, so it has sigmoid sinus. Then we have the inferior petrosal sinus, then meningeal branch of ascending pharyngeal artery. In middle, it is easy, it's the middle ground, so it's 9th, 10th, 11th cranial nerve, and posterior is also easy, IJV and meningeal branch of occipital artery. Alright, so these are the important structures that are marked in, that are given in Pulse, and you should know them. You can't skip. So I hope I made it easier for you to remember through these tricks. And if you like the video, do subscribe to my channel. Thanks for watching.